What investigations are carried out in asthma? There are six major types: lung function test, peak expiratory flow rate, bronchial provocation test, chest radiograph, skin prick test, and exhale nitric oxide. Let us look them in detail. Lung function test is the diagnostic test used in asthma. What we will see in lung function test? We will see forced expiratory volume upon forced vital capacity. Wait, do you know what is forced expiratory volume? Well, forced expiratory volume measures how much air a person can exhale during a forced breath. And what is forced vital capacity? It is the maximum amount of air you can forcibly exhale from your lungs after fully inhaling. They both are decreased in asthma. Important thing: if this test shows improvement in FEV1 greater than 15% with the use of bronchodilators, then you have to think asthma. But if it's not improved with the bronchodilators, then think of COPD, which I will discuss later in my next video. What is peak expiratory flow rate? These are the morning and evening measurements which are useful in the long term assessment of asthma. A characteristic morning dipping pattern is seen in poorly controlled asthma. And similarly, in occupational asthma, a reduction in peak flow can be seen during work hours, with return to normal when the patient is off work. Third investigation include bronchial provocation test. Well, it's rarely performed nowadays in the normal clinical practice because it is highly expensive and invasive. In this test, we use histamine or methylcholine to demonstrate bronchial hyperactivity. Instead of this test, the doctors they prefer to test allergic testing, serum IgE levels and eosinophil count that are useful in some of the patients. Fourth investigation, chest radiography has no diagnostic features of asthma on chest radiograph. But it is done in the cases of asthma. Why? To rule out a diagnosis of other pulmonary diseases like allergic bronchopulmonary aspergillosis, pneumothorax, COPD, chronic obstructive pulmonary disease. So for this purpose, chest radiograph is offered in the asthma patient. Fifth investigation test include skin prick test. Skin prick test allows the allergic injections into the epidermis of the forearm, which are used to identify the extrinsic causes, like the food allergy and the eczema. The last test include exhaled nitric oxide, in which the levels of exhaled nitric oxide is measured in the blood, which is an indicative of airway inflammation. But as this test is really expensive and very difficult to carry out in normal laboratories, so it is rarely used in the clinical practice.